Namaste to all of you. Today I'm going to discuss a very important topic, that is IBS, irritated bowel syndrome. You see, in general practice every day, we get so many patients with a typical complaint of having pain in the abdomen. And if it's more than 6 months, 5, 6 months, patient is suffering from, and is associated with the movement of the bowel, then we have to label it as IBS. IBS, that is, bowel movement is irritated. And you see that bowel movement can be of three types. Either patient is having diarrhea, or patient is having constipation, or he is having episodes of diarrhea and constipation. That few weeks he is having diarrhea, that few days he is having constipation. You see, besides this cramps in the stomach, patient can have abdominal flatulence. That is, there is bloating. And mostly this pain is after having food. And patient, in that case, he feels relieved after passing the stools. So these are few common complaints that patient of IBS can have. So if we see that how come that patient is suffering from that, there can be different reasons. Earlier, this type of disease was labeled as psychosomatic disease. That if mind is one way or other agitated, that can irritate your bowels, because increased activity of nervous supply to the gut, that can increase the activity of your bowel. So that we see also in the practice, that there are a lot of people, if they have to undergo an exam or interview, then they have got diarrhea. Because of the nervousness, there is an increased activity of the nervous supply, and that nervous supply is giving that stimulation to your gut. But in the practice, we see there are a lot of patients, they are not stressed. Even then, they have got this problem. So they clearly say that they had diarrhea or they had cramps in the abdomen for a few months, and after that, because of the pain, they got irritation in the mind, and that has given them depression, stress, things like that. But it's not always brain-gut relation, but it can be gut and brain relation also. You see, in Ayurveda, we have got Saman Vata, and that is part of central nervous system, what regulates GIT, gastrointestinal tract. So your Saman Vata is responsible for GIT regulation. You see, if Saman Vata is one way or other is hyperactive, so it's going to activate your GIT, your gastrointestinal tract. So this is what hyperactivity of GIT is in the form of diarrhea. So patient feels diarrhea because it's hyperactivated. But if patient tells you clearly that it started all with abdominal irritation, diarrhea, after that, because of the pain and diarrhea or constipation, episode of diarrhea and constipation, they got irritated and they got stressed, then we know that Samanvata, what was supposed to work in GIT, has influence Pranavata, what is working in your mind. Dhi Dhriti Smriti, to take decision, to be happy. So that is a sort of avaran, but in Ayurveda it's clearly stated that Vata, Saman Vata, has got avaran on Pranavata. So that's why Pranavata is not functioning well, and its function is Dhir Dhriti Smriti, to take decision, to be confident, to be happy, to take right decision. And just opposite to that is depression, stress. So that way, this is gut-brain relation. And now, if patients tell you clearly that there is a history of depression, there is a history of stress, then we know that that pranavata, because that works in brain, so that pranavata has disturbed the function of smanavata in the gut, in the intestines. So that way, what we say, that this is brain-gut relation. So first was gut-brain relation, but in this case is brain-gut relation. So that's why history taking is very, very important to treat the patient. So not all the diseases are psychosomatic. So one can influence the other organ. So in Ayurveda, this is described as avarans. That Samanavata has got avarn on Pranavata, and Pranavata has got avarn on the Samanavata. So if we see what type of abnormalities happens in this syndrome, then we come across hypersensitivity. What can be seen as allergy also. Allergy with very little change in food habits, or the things what you are not used to, like spices, gluten, milk, coffee, alcohol, fried food, restaurant food, and that works as a trigger and gives you allergic reaction, and patient is having irritated bowel, that he is having diarrhea or he is having constipation with cramps, abdominal cramps, nausea. So this is all what has worked as a trigger, and we can call that allergy. Then if we see other abnormality, but in these cases we can see that perhaps patient has got intestinal infection. And if there is intestinal infection, then patient is having mucus and blood with the stools. The patient is not aware of that because it's mixed with stools. Or it can be so low grade, so less in the quantity that patient is not aware of. So in that case, we have to treat intestinal infection. Then there is one more abnormality, that is of autoimmune irritation, that patient's immune system is agitated, irritated, hyperactive. It's possible that patient's immune system is not able to discriminate, to differentiate good food and bad food. Also, he is reacting to the good food. So in that case, we have to treat autoimmune system of the patient. So then if we talk about management of IBS, first of all, we come across visual activation, hyperactivity. So that is because of the Samanvata. Samanvata is activated, and that has activated the bowel. So in that case, we have to treat Samanvata. We must give herbs what is going to work on that. That is like Vacha, Brahmi. These are all sedative herbs, and that has got very good effect on our Samanvata. And secondly, we see that if patient has given you information that he was depressive before he started getting irritation in the gut, then we have to give him things like neurotransmitters, that Jyotishmati we have got, that what he can see clearly. The name says itself, Jyotishmati. So there are a lot of herbs in Ayurveda what we use what is antidepressant, and of course Manas Shakti, Ashwagandha, and this Brahmi I've discussed already. So this group has to be given so that he can discriminate in good and bad things, so that he can develop the taste for the right food. Patient should have a taste for the things what is good for him. So this is his own intelligence. So therefore we give what gives you awareness that what is good, what is not good for yourself. Then we have got other category in which we see that patient immune system is not that good. Because of this autoimmune activation, there can be intestinal mild chronic inflammation. So patient is not aware of, but it gives all the time problem in the gut. So therefore, we have to treat him for his immune system. So for this type of problems, we have to give him then immunomodulator. And we in Ayurveda have got very good immunomodulator like Philanthus niruri, that is Bhumi Amalki. Bhumi Amalki along with Ashwagandha, these are immunomodulator. So that way they correct the function of our immune system. Guduchi can be also given in this case. So this group has to be given if you have diagnosed your patient that IBS is because of the autoimmune disease. And a lot of women, a lot of patients with IBS, they have got also history that it was in their family. And so this type of patient should also given this type of immunomodulators. So then we have seen that a patient can have hypersensitivity or allergy if they take any food stuff like what I said, spices, coffee, alcohol, fried things. It can be gluten, it can be milk. So that works as a trigger. So in that case, we have to give something what works on that allergy, and that is in Ayurveda, Haridra. So we process most of the food with Haridra, Curcuma longa, and Sirish, Albizia labec. So that type of herbs we give. And intestinal infection is one major cause of the trigger. So if your diagnosis is that there is infection in the intestine, then we have to give something to remove that infection. And we have got very good herbs like chitrak, like sariva, like manjishtha, and you have got a beautiful herb that is chiraita, and one very, very famous compound we have got that is Sudarshan Vati. In Sudarshan, you have got this charaita, and that's very, very good for intestinal infection. So whatsoever you have diagnosed, the reason behind the IBS, so that is to be treated. So you can't give always something laxative or something anti-diarrheal. So if you have diagnosed that there is infection, then we have to treat infection. If it's autoimmune, then we should give attention to that. So that way, we can treat the patient. Always we have to see that where lies the problem, what is the reason behind, and that can be treated. Talk to your patient thoroughly, give attention to what he is saying, and if you have diagnosed the reason behind, that way we can treat our patient thoroughly. So I hope that I have made my point clear, and wish you all the success with your IBS patients. Thank you.